Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that explores a suspected form of epilepsy in dogs, one that manifests primarily with signs of vestibular disease. In human medicine, a condition known as vestibular epilepsy has been described as focal seizures where the main or only symptoms are related to the vestibular system, which is responsible for balance. These signs in humans can range from a mild feeling of being off balance to severe dizziness and vertigo. Typically, these episodes are short, lasting only a few seconds, but sometimes they can extend to several minutes. While this type of epilepsy has been studied in humans, in veterinary medicine, there are only a couple of reports describing vestibular episodes in dogs, referred to as vestibular paroxysmia. These are brief attacks of vertigo. The aim of this particular research was to better understand the clinical features, how this condition appears in dogs, and what the eventual outcomes are for dogs suspected of having vestibular epilepsy. The researchers conducted a retrospective study, looking back at the medical records of 10 dogs that had experienced recurrent episodes of vestibular issues. To be included in the study, these dogs had to have a normal neurological examination between episodes, a history of transient signs indicating vestibular problems, and no abnormalities detected in their blood work or on brain imaging, either with magnetic resonance imaging or computed tomography scans. Furthermore, the dogs had to be followed for at least 10 months. The study considered a dog to have shown clinical improvement if there was a 50% or greater reduction in the frequency of their vestibular episodes, or if these episodes stopped entirely after they started receiving anti-seizure medications. The results of this study revealed that pugs were the most common breed among the 10 dogs, making up half of the study group. Interestingly, in 2 of these cases, the dogs also experienced more generalized seizures, known as generalized tonic-clonic seizures, in addition to their vestibular episodes. In most of the cases, specifically 9 out of 10 dogs, a magnetic resonance imaging examination of the brain was performed, and 1 dog underwent a computed tomography scan. Electroencephalography, a test that measures electrical activity in the brain, was conducted in 3 of the dogs. These tests showed abnormal electrical activity, specifically interictal spikes, in the frontotemporal and frontoparietal regions of the brain. Importantly, all 10 dogs in the study were treated with anti-seizure medications, and all of them showed clinical improvement. Based on these findings, the researchers concluded that the presence of generalized tonic-clonic seizures in some dogs, the abnormal electrical activity seen on electroencephalography, and the positive response to anti-seizure medications all supported the idea that these vestibular episodes were indeed epileptic in origin. This suggests the existence of vestibular epilepsy in dogs, with what appeared to be an unknown, or idiopathic, cause and a generally positive outcome with treatment.
Now let's continue exploring the details and implications of this study on suspected idiopathic vestibular epilepsy in dogs. Looking closer at the clinical features observed in these 10 dogs, the most common signs included a sudden onset of vestibular ataxia, which is a lack of coordination, leading to lateral drifting. Many dogs also exhibited rolling, a tilt of the head, and nystagmus, which are involuntary rapid movements of the eyes, typically horizontal in direction. These signs of vestibular disease were transient, lasting from less than a minute to a maximum of 1 hour. A key characteristic was that the episodes ended abruptly, and the dogs immediately returned to their normal state, without showing typical post-seizure signs like disorientation or compulsive behaviors. Interestingly, during these episodes, the dogs appeared to be responsive to their owners' voices. The frequency of these episodes varied greatly among the dogs, ranging from occurring daily to only a few times per year. When it came to investigations beyond imaging, cerebrospinal fluid samples were collected from 4 of the 10 dogs and were found to be within normal limits. As mentioned earlier, 2 of the dogs also experienced isolated generalized tonic-clonic seizures in addition to their vestibular signs. In 1 dog, there was a 2-year history of generalized tonic-clonic seizures before the vestibular episodes even began. In this particular dog, both the brain magnetic resonance imaging and cerebrospinal fluid analysis were normal, leading to a suspicion of idiopathic epilepsy. Another dog was initially referred for the recurrent vestibular disorder, which resolved after starting anti-seizure medications. However, this dog later developed generalized tonic-clonic seizures 3 years later, after the owner decided to stop the medication. Regarding treatment, due to the increased frequency or severity of the episodes, all 10 dogs were given anti-seizure medications. The most commonly used medication was levetiracetam, administered to 9 of the 10 dogs, either alone or in combination with other drugs like phenobarbital or gabapentin. One dog was treated with phenobarbital alone. The follow-up period for these dogs ranged from a minimum of 10 months to a maximum of 4 years. Encouragingly, clinical improvement, marked by a decrease in the frequency, duration, and severity of the vestibular episodes, was observed in all 10 cases. In half of the dogs, the vestibular episodes disappeared completely after starting treatment with levetiracetam alone. In the other half, a reduction in the frequency or severity of the vestibular signs was noted. Notably, in the dog treated with phenobarbital alone, the frequency of episodes decreased significantly, from daily to once every 2 months. At the time this study was written, 2 of the 10 dogs had passed away due to reasons unrelated to their neurological condition, specifically due to old age. The researchers in this study highlighted that there is a lack of detailed information in veterinary literature, specifically focusing on this type of suspected idiopathic vestibular seizure in dogs. In all the cases they examined, the reported vestibular episodes could have potentially been classified as either vestibular epilepsy or vestibular paroxysmia. While it can be challenging to distinguish between these two conditions based solely on clinical signs, the fact that some dogs also had generalized tonic-clonic seizures, along with the abnormal electrical activity seen on electroencephalography in some, and the positive response to anti-seizure therapy, strongly suggested an epileptic origin for the vestibular episodes in this group of dogs. Therefore, this study provides support for the possible existence of vestibular epilepsy in dogs, likely with an unknown underlying cause, and affecting dogs across a wide range of ages. The fact that pugs were the most common breed in this small study is interesting. While the researchers caution that this could be due to the limited number of cases, they speculate that since pugs have been reported to have a higher prevalence of seizures in general, they might also be predisposed to vestibular epilepsy. However, they emphasize that more research with a larger number of dogs is needed to explore this potential breed predisposition further. The study also compared these findings in dogs to what is known about vestibular paroxysmia in humans. In humans, vestibular paroxysmia is thought to be caused by a blood vessel compressing the 8th cranial nerve, leading to nerve hyperexcitability. In humans, the attacks are typically very frequent, short-lasting, less than 60 seconds, and respond well to specific medications like carbamazepine and oxcarbazepine, which primarily block sodium channels in nerve cells. High-resolution brain imaging can sometimes identify this nerve vessel contact in humans. In contrast, in this study on dogs, diagnostic imaging did not detect any compression of the vestibulocochlear nerve, although the researchers acknowledge that the use of lower-field magnetic resonance imaging could have made it harder to identify. Unlike in human vestibular paroxysmia, the vestibular attacks in these dogs often lasted for several minutes, and in some cases up to an hour. Furthermore, none of the dogs in this study were treated with the sodium channel blocking drugs that are typically effective in human vestibular paroxysmia. Also, while many humans with vestibular paroxysmia experience remission even after stopping medication, this was not observed in any of the dogs in this study without continued anti-seizure medication. The study also discussed 2 previously reported cases of presumed vestibular paroxysmia in dogs, highlighting differences in their clinical presentation and response to treatment compared to the dogs in this study. The researchers also considered the human literature on epileptic vertigo or dizziness, noting that it is a less common form of epilepsy in people. While the clinical signs can vary, nystagmus is not frequently associated with it in humans. In contrast, nystagmus was observed in most of the dogs in this study. Interestingly, in humans, isolated vestibular epilepsy, where vestibular signs occur without other seizure symptoms, is less common than when it occurs with other epileptic manifestations. The researchers speculate that in dogs, isolated vestibular epilepsy might be more frequent, as only 2 dogs in their study also experienced generalized tonic-clonic seizures. In one of these dogs, the generalized seizure started after the anti-seizure medication used for the vestibular episodes was stopped, and electroencephalography in this dog showed abnormal electrical activity in the frontotemporal region, further supporting the idea of epilepsy. This is consistent with human studies that often find seizure activity in the temporal lobe in cases of vestibular epilepsy. In the other dogs in this study that only had vestibular signs, electroencephalography showed abnormal activity in the frontal and frontoparietal areas, which aligns with findings in some human cases where other cortical areas besides the temporal lobe can be involved. The researchers also discussed the temporoperi-sylvian vestibular cortex in humans, an area involved in processing vestibular signals, and noted that the electroencephalography findings in the dogs, showing abnormalities in the temporal, parietal, and frontal lobes, could support their hypothesis of an epileptic origin. In some cases, the side of the brain showing abnormal electrical activity correlated with the side of the neurological signs observed, which could be another indicator of an epileptic origin. The study also briefly touched on the complex mechanisms of head movements during seizures in both humans and animals. The fact that up to 90% of human patients with vestibular epilepsy respond favorably to anti-seizure medications was also observed in this study with dogs. While a positive response to these medications can suggest an epileptic origin, the researchers caution that it should not be the only factor considered. The study did have some limitations. Electroencephalography was not performed on all the dogs, which could have provided more comprehensive data. While abnormal electrical activity was detected in all dogs that underwent the test, further studies with a more complete diagnostic plan are needed. Also, cerebrospinal fluid was only collected from 4 dogs, which might have missed other underlying conditions, although the lack of progressive clinical signs in the other dogs makes inflammatory, infectious, or neoplastic diseases less likely. Additionally, 1 dog was evaluated with a computed tomography scan instead of magnetic resonance imaging, which is generally considered better for visualizing soft tissues in the brain. However, the researchers point out that computed tomography is often used in the initial evaluation of suspected brain lesions in human medicine. Despite these limitations, the researchers conclude that the data collected in this study represent an important preliminary step in understanding potential idiopathic vestibular epilepsy in dogs. The small number of cases identified over a long period suggests that this form of suspected epilepsy might occur with a low incidence in dogs, similar to what has been reported in human medicine. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.